Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Liver Transplantation. Introduction. Your liver helps fight infections and cleans your blood. It also helps digest food and store energy. You cannot live without a functioning liver. If your liver fails, your healthcare provider may put you on a waiting list for a liver transplant. Liver transplants are done when other treatments cannot keep a damaged liver working. This program explains liver transplantation. It discusses the transplant surgery, its risks and complications, and how to take care of yourself after surgery. The liver. The liver is the largest organ in your abdomen. It is found right behind your ribs on the right side of your body. It sits below your diaphragm and above your stomach. There are two sections of the liver. They are called the right and left lobes. Under the liver is the gallbladder. Parts of the pancreas and intestines are also under the liver. The liver keeps you healthy by removing harmful toxins from your blood, making enzymes and bile that help you digest food, turning food into substances needed for life and growth in the body. Liver failure. Liver failure has many causes. Depending on how poorly your liver is functioning, your healthcare provider may decide that you need a liver transplant. In adults, chronic active hepatitis and cirrhosis are the most common diseases that require liver transplantation. In children and adolescents younger than 18 years, the most common reason for liver transplantation is biliary atresia. This is an incomplete development of the bile duct. People who have liver disease may have many of the following problems. Jaundice, the yellowing of the skin or eyes. Itching. Dark-colored urine. Gray or clay-colored bowel movements. Ascites, an abnormal buildup of fluid in the abdomen. Vomiting blood. Mental confusion, drowsiness, and forgetfulness. Mild problems caused by liver disease may be controlled with medicines. For example, diuretics can increase urine output. Several other problems may arise from liver disease. Infection in the abdomen, known as bacterial peritonitis, is a life-threatening problem. It happens when bacteria or other organisms grow in the ascites fluid. Liver disease causes scarring. This makes blood flow through the liver difficult. It may increase the blood pressure in one of the major vessels that supply it. This process may result in serious bleeding. Blood may also back up into the spleen and cause it to increase in size and to destroy blood cells. Blood may also go to the stomach and esophagus. A non-functioning liver may not be able to cleanse the blood of harmful toxins. This can lead to coma and death. These problems may become hard to control with medicines and can be a serious threat to your life. A liver transplant may be recommended by your healthcare provider. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Transplant. The liver donor is the person who gives all or part of his or her liver to the waiting patient who needs it. Donors are usually people who have died and wish to donate their organs. With a living donor transplant, a healthy person donates part of his or her liver to the recipient. Orthotopic liver transplantation is a procedure in which a failed liver is removed from the patient's body. A healthy donor liver is transplanted into the same location. In this case, the liver donor is someone who has recently died. The procedure is the most common method used to transplant livers. Your healthcare provider will determine if a liver transplant may be safe and beneficial for you. Your evaluation may include physical exam, blood tests, imaging tests including X-rays, You will also have consultations to discuss the cost of the procedure. Your healthcare team will discuss with you what to expect after a liver transplant, including lifestyle changes and medications you will take. If your healthcare providers determine that you are a good candidate for a liver transplant, your name will be placed on a waiting list. You may be on a waiting list from a few days to several months. Your time on the waiting list often is determined by your score on the Model for End-Stage Liver Disease, or MELD. MELD ranks people waiting for a transplant based on the severity of their condition and how urgently they may need a transplant. A person who needs a liver transplant may not qualify. People with active alcohol or substance abuse problems may continue living the unhealthy lifestyles that led to their liver damage. Transplantation would result in the failure of the new liver. Other factors that make a person not a good candidate for liver transplant include cancers in parts of the body other than just the liver, advanced heart and lung disease, HIV infection. Before undergoing liver transplantation, people who have liver disease should avoid medications that may further damage the liver. Large amounts of acetaminophen or Tylenol may be harmful and can damage the liver. Sleeping pills and benzodiazepines can build up faster in the blood when the liver doesn't work well. They can make a person confused, worsen existing confusion, and cause coma. Alcohol can severely damage the liver. Avoid it and all medications that contain alcohol. Alcohol is an ingredient in some cough syrups and other medications. Women should not take oral contraceptives because of the increased risk of blood clot formation. Pregnancy should be avoided by transplant recipients until at least 1 year after transplantation. No transplant recipient should receive live virus vaccines. No household contact should receive these either. Surgery. During surgery, your surgeon removes your diseased liver. It is replaced with the donor liver. Surgery usually lasts 4 to 5 hours. The incision on the belly is in the shape of an upside-down Y. Small, plastic bulb-shaped drains are placed near the incision to drain blood and fluid from around the liver. These are called Jackson-Pratt drains. They may remain in place for several days until the drainage decreases. A tube called a T-tube may be placed in your bile duct. The tube lets bile drain outside the body into a small pouch called a bile bag. The tube remains in place for about 3 months after surgery. Bile production early after the surgery is a good sign. It means that the new liver is being accepted by your body. In a living donor liver transplant, surgeons remove your entire liver and replace it with a portion of your living donor's liver. Your donor's liver and the portion of the liver given to you grow back to its full size in a few weeks. Risks and complications. The operation is very safe. However, there are several unlikely risks and complications. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. The risks and complications include those related to anesthesia and any type of surgery. Risks of general anesthesia include nausea, vomiting, urine retention, cut lips, chipped teeth, sore throat, headache. More serious risks of anesthesia include heart attack, stroke, pneumonia. Your anesthesiologist will discuss these risks with you. He or she will ask if you are allergic to certain medications. Complications may happen after liver transplantation. Contact your healthcare provider if you experience any of the following problems. The T-tube drains bile to the outside of the body into a bile bag. The site may become infected. Symptoms of infection include warmth around the T-tube site, redness of the skin around the site, discharge from the site. The T-tube may come out of place. Stitching on the outside of the skin that holds the tube in place may break. The length of the tube outside the body may increase. Bile leak may happen when bile leaks outside of the ducts. The patient may experience nausea, liver pain, or fever. Biliary stenosis is narrowing of the duct, which may result in blockage. The bile may back up in the body and result in yellowing of the skin. Infections may happen from being on the immunosuppressive medications. Although these medications are meant to prevent rejection of the liver, they also decrease the ability of the body to fight off certain viruses, bacteria, and fungi. If you have a fever within a year of receiving a liver transplant, contact your healthcare provider right away. After surgery. After your liver transplant surgery, you will usually spend 1 to 2 days in the intensive care unit. You will stay in the healthcare facility for 7 to 9 days to recover. During your stay, your transplant team will monitor your recovery. Your team will provide you with instructions on post-transplant recovery, care, lifestyle changes, and medications. When you go home, you will gradually return to your daily life activities and recover to the level of health that you had before surgery. This can be a long, slow process. At first, you may need assistance when walking. Your diet may at first consist of ice chips, then clear liquids, and finally solids. It is important to eat well-balanced meals with all food groups. After about 3 to 6 months, a person may return to work if he or she feels ready and it is approved by the healthcare provider. Because the transplanted liver is not genetically identical to yours, your body may attempt to reject it as foreign material. You will need to take immunosuppressive medications daily for the rest of your life. These medications keep your body from rejecting your new liver. Your transplant team will discuss your new medications in detail. Immunosuppressive medications weaken the immune system. This is why transplant patients are more likely to get certain infections. To prevent infections, the patient must also take preventive medications.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Liver disease that is severe enough to require a liver transplant can come from many causes. If you have certain health problems or symptoms, your healthcare provider may decide that you need a liver transplant. If your healthcare providers determine that you are a good candidate for a liver transplant, your name will be placed on a waiting list. You may be on a waiting list from a few days to several months. During surgery, your surgeon removes your diseased liver. It is replaced with the donor liver. Surgery usually lasts 4 to 5 hours. You will need to take immunosuppressive medications daily for the rest of your life. These medications keep your body from rejecting your new liver. Your transplant team will discuss your new medications in detail.
Thank you for using Explain.